Most Americans want to know about their baby's genetic risk for treatable childhood disorders. Sema4, a health information company providing advanced genomic testing, today announced the results of a public opinion poll of among more than 2,000 Americans about newborn genetic screening. According to the survey commissioned by Sema4 and conducted online by Harris Poll, 88% of Americans say that if they were new parents and could find out just after the baby is born about their child's genetic risk of getting a treatable early onset disease, they would want to know. Similarly, 92% of Americans think it is important for new parents to be able to learn about their baby's genetic risk of treatable early onset conditions that typically manifest in a child's first 10 years. This poll to assess the attitude of consumers toward genetic screening for newborns is just one component of our overall program to gain new insights into genomic health, said Eric Schott, PhD, founder and CEO of Sema4. We seek to understand in partnership with our patients and the scientific and medical communities the benefits of obtaining supplemental genetic information at birth. To this end, we are in the process of launching a clinical study to explore the utility of supplemental newborn screening to both patients and physicians, including how individuals respond to this new type of actionable information, what actions they take as a result, and how this ultimately impacts health outcomes and healthcare utilization. The results of the poll were announced on Rare Disease Day, an international day of awareness that shines a light on rare diseases and their impact on patients' lives. According to the Global Genes and Shire Rare Disease Index report, more than 7,000 rare diseases have been identified, 80% of which are caused by genetic variations. These diseases collectively affect 30 million Americans, half of whom are children. Today, it takes most rare disease patients an average of 8 years to obtain an accurate diagnosis. While most rare diseases still have no FDA-approved treatment, some genetic diseases have known effective treatments, especially when administered early. These can be as simple as a change in diet or vitamin therapy, as in the case of pyridoxine-dependent epilepsy, which is treatable with a form of vitamin B6. Such a life-saving and simple intervention for this rare form of epilepsy was dramatically illustrated in a recent case at Rady Children's Hospital in San Diego. In the United States, newborns are typically screened at the hospital for 34 health conditions on the recommended uniform screening panel, but the conditions screened vary by state and represent only a fraction of the genetic diseases that can manifest in a child's first decade of life. Pyridoxine-dependent epilepsy, for example, is not currently on any state panel. Parents would like more information than most state newborn panels provide. According to the survey, 87% of Americans say that if the newborn screening test in their state did not cover many treatable conditions that could affect a child in his or her first years of life, and supplemental non-invasive DNA test was available to screen for such conditions, they would be likely to request this supplemental test. In my practice, I find that parents generally want as much information as possible related to the health of their babies, and access to genomic data now opens up a whole new era, said Dr. Joanne Stone, Director of Maternal Fetal Medicine for Mount Sinai Health System and Professor of Obstetrics, Gynecology, and Reproductive Science at the Icahn School of Medicine at Mount Sinai. When accompanied by appropriate genetic counseling, high-quality DNA testing can provide valuable, actionable insights and help guide decision-making as part of the parental journey from preconception carrier screening to expanded screening for newborns. In general, we're finding that interest is growing among parents in taking more control of the health of their family. Sema4, which commissioned the poll, was founded on the idea that more information, deeper analysis, and increased engagement will improve the diagnosis, treatment, and prevention of disease. As part of its clinical laboratory services, the company offers DNA tests for parents and prospective parents who are interested in gaining more insight into their own genetic carrier status, as well as their newborn's genetic risk factors. For example, Sema4 NATALYS screens for more than 5 times the number of genetic diseases on a standard state-mandated test, as well as the potential for adverse reactions to medications commonly prescribed during childhood. Testing takes place in a rigorously controlled CLIA certified laboratory and is overseen by qualified physicians. Rare disease advocate Kim Tuminellos, co-founder Association for Creatine Disorders, commented, "The idea of every family having screening information about deficiency following birth as opposed to the average 8-year-old odyssey that most families currently endure is a concept that is now possible through the SEMA4 NATALYS screening test. We are excited to share the news with all our member families about the availability of SEMA4 NATALYS."